7 hidden symptoms of diabetes you might be ignoring. 7 hidden diabetes symptoms that strike without warning. Imagine waking up feeling perfectly fine, unaware that your body has been silently deteriorating for months. By the time symptoms become noticeable, the damage may already be severe. Diabetes isn't just about elevated blood sugar, it's a silent threat. Each year, over 100,000 people lose their lives to its complications, often without realizing the danger beforehand. Many assume they'd recognize the warning signs, but diabetes is deceptive. Symptoms develop gradually, often mistaken for fatigue, minor aches, or stress, until suddenly a heart attack occurs, an infection spreads uncontrollably, or an organ begins to fail. In this video, I'll reveal 7 deadly diabetes symptoms that can emerge without warning, hidden dangers that, if ignored, could lead to coma, amputations, or even death. The most dangerous symptom is the one most frequently overlooked. Stay with me until the end because recognizing these signs could save your life. Diabetic ketoacidosis. One of the most life-threatening complications of diabetes, diabetic ketoacidosis, DKA, can develop at an alarming rate. When the body lacks sufficient insulin to process glucose, it begins breaking down fat for energy, generating toxic substances called ketones. As these ketones accumulate in the bloodstream, they acidify the blood, poisoning the body from within. If left untreated, DKA can lead to organ failure, coma, or even death within hours. What makes DKA particularly frightening is its rapid progression. It often begins with excessive thirst, dry mouth, and frequent urination, symptoms that can be easily dismissed. However, as ketone levels rise, more severe indicators appear: nausea, vomiting, intense fatigue, and abdominal pain. Many individuals also develop breath with a fruity odor, a dangerous sign that acid levels in the blood have become critically high. Though more common in type 1 diabetes, DKA can also affect those with type 2, especially in times of illness, infections, missed insulin doses, stress, dehydration, or medication side effects. Because symptoms worsen quickly, regularly checking blood sugar and ketone levels is crucial, particularly if you feel unwell, weak, or confused. If signs of DKA appear, seek emergency medical attention immediately. This condition requires intravenous insulin and fluids to stabilize the body and neutralize acid buildup. Delaying treatment can lead to coma or death, so never ignore early warning signs. If you have diabetes, always have a plan in place to prevent and respond to DKA before it's too late. Symptom 6. Heart attacks and stroke. Diabetes quietly damages the heart and blood vessels, doubling the risk of heart attacks and strokes over time. High blood sugar thickens artery walls, triggering harmful inflammation that restricts blood flow to vital organs. Even more alarming, diabetes can impair nerve function, reducing the body's ability to feel pain. As a result, many individuals never experience chest pain before a heart attack occurs. By the time they sense something is wrong, it may already be too late. Unlike the crushing chest pain most people expect, a heart attack in diabetics often manifests through subtle signs such as sudden breathlessness, dizziness, nausea, extreme fatigue, or pain in the jaw or back, symptoms that are frequently dismissed as stress or aging. Similarly, strokes can begin with mild confusion, blurred vision, or weakness in one limb before rapidly progressing to permanent brain damage. Compounding the risk, conditions like high blood pressure, high cholesterol, and obesity, all commonly linked to diabetes, make cardiovascular issues even more severe. If you have diabetes, regular monitoring of blood pressure and cholesterol is vital. Don't ignore symptoms like unusual fatigue, shortness of breath, dizziness, or unexplained discomfort in the chest, jaw, or left arm. If you notice these signs, call emergency services immediately. The sooner a heart attack or stroke is treated, the better the chances of survival and recovery. A silent heart attack doesn't mean it's harmless. It just means you won't get a second chance to recognize it. Symptom 5. Kidney failure. Your kidneys serve as the body's filtration system, removing waste and excess fluids from the blood. However, prolonged high blood sugar slowly damages the tiny blood vessels in the kidneys, impairing their function. This decline occurs gradually and painlessly, meaning many diabetics remain unaware of the damage until kidney failure is imminent. Early signs of kidney disease include frequent nighttime urination as the kidneys struggle to eliminate excess sugar. Other warning signs include swelling in the feet, face, or hands, persistent fatigue, and nausea. As kidney function deteriorates, waste accumulates in the bloodstream, leading to high blood pressure, severe itching, and even mental confusion. Because these symptoms resemble other common health issues, diagnosis is often delayed. Shockingly, 1 in 3 adults with diabetes will develop kidney disease, and many won't realize it until they reach end-stage kidney failure, at which point dialysis or a kidney transplant becomes the only option. Without treatment, toxins rapidly build up in the blood, potentially causing seizures, coma, and death. This is why regular kidney function tests are critical, even if you feel fine. Maintaining tight blood sugar control and staying hydrated can help reduce the risk. Kidney failure doesn't happen overnight, but once symptoms appear, the damage is often irreversible. Symptom: severe hypoglycemia. While most people associate diabetes with high blood sugar, dangerously low blood sugar, or hypoglycemia, can be just as deadly. It strikes suddenly, depriving the brain of the glucose it needs to function. Within minutes, it can cause confusion, unconsciousness, seizures, or even death. What makes hypoglycemia particularly frightening is that many diabetics don't recognize it's happening until it's too late. Early signs include shakiness, sweating, and sudden anxiety as the body struggles to correct the imbalance. But as blood sugar continues to drop, symptoms worsen, leading to slurred speech, blurry vision, confusion, and extreme weakness. If left untreated, the brain may begin shutting down, triggering coma or fatal heart arrhythmias. For some diabetics, the body's ability to detect low blood sugar declines over time, leading to hypoglycemia unawareness, a condition where warning signs never appear. This makes it even more dangerous, as the first symptom could be sudden collapse or unconsciousness. Common triggers for hypoglycemia include skipping meals, taking too much insulin, or engaging in intense physical activity without eating enough. Older adults and long-term diabetics are at even higher risk. Since a blood sugar crash can happen at any time, carrying fast-acting glucose like juice, candy, or glucose tablets is essential. If you or someone nearby shows signs of hypoglycemia, act immediately. Don't wait for symptoms to worsen. Consume glucose, or if the person is unconscious, administer glucagon if available. If they don't recover within minutes, seek emergency medical help. Without fast intervention, hypoglycemia can become fatal. Symptom number 3, nerve damage, diabetic neuropathy. Diabetes doesn't just affect blood sugar, it can also destroy nerves, leading to a condition called diabetic neuropathy. It often starts with mild tingling or numbness in the feet, but can escalate into severe pain, loss of sensation, and dangerous infections. The biggest danger with nerve damage is that it hides serious injuries. Without proper sensation, you might not notice a small cut, blister, or infection. Over time, these wounds can turn into ulcers that refuse to heal, eventually leading to gangrene, where tissue dies. Once gangrene sets in, amputation may be the only way to stop the infection from spreading. Diabetes also reduces circulation, making it harder for wounds to heal and for the immune system to fight infections. Even minor injuries can spiral into life-threatening complications. In fact, diabetics are 15 times more likely to require a foot or leg amputation compared to non-diabetics. The worst part? Once nerve damage begins, it cannot be reversed, only managed. That's why daily foot checks and early treatment are critical. Never ignore numbness, pain, or slow-healing sores. Proper foot care, protective footwear, and regular checkups can prevent serious complications. Remember, diabetic nerve damage doesn't just cause discomfort, it can cost you your limbs and, ultimately, your life. Symptom number 2, mental health breakdown. Diabetes doesn't just impact the body, it takes a serious toll on the mind. The constant stress of managing blood sugar, medications, and complications can lead to severe anxiety, depression, and even suicidal thoughts. Many diabetics experience diabetes distress, a state of emotional exhaustion that makes managing their health overwhelming. When this happens, they may start neglecting treatment, leading to dangerous consequences. Stress triggers the release of cortisol, which raises blood sugar, making diabetes harder to control. At the same time, high blood sugar itself can cause mood swings, brain fog, and chronic fatigue, leaving people feeling hopeless. This often results in diabetics skipping medications, avoiding glucose checks, or making poor dietary choices, not due to neglect, but because they feel mentally drained. Shockingly, research shows people with diabetes are twice as likely to suffer from depression, but many go undiagnosed. Signs include social withdrawal, persistent anxiety, and sudden emotional outbursts. Financial stress from medical expenses, medications, and supplies can add another layer of burden, making proper care feel impossible. Neglecting mental health can lead to life-threatening neglect of diabetes management. If you feel overwhelmed, anxious, or depressed, seek help from a doctor, therapist, or support group. Mental health is just as important as physical health, and ignoring emotional well-being can lead to deadly consequences. Diabetes is tough, but suffering in silence is even more dangerous. Symptom number 1, deadly infections, the most dangerous complication. Out of all the complications of diabetes, deadly infections are the most dangerous, not because they are the most common, but because they are the most fatal and often overlooked until it's too late. While heart attacks and hypoglycemia can be fatal in minutes, infections creep in silently. By the time symptoms become obvious, survival rates have already dropped significantly. A small cut, blister, or ulcer can rapidly escalate into sepsis, a condition where bacteria enter the bloodstream and trigger organ failure. Sepsis has a mortality rate of up to 40% and can become fatal within hours. Unlike other complications that affect one organ, infections spread uncontrollably, leading to multiple organ failure. If not caught in time, even the best medical treatment may not be enough. One of the biggest reasons infections are so deadly in diabetics is because nerve damage reduces pain sensation, meaning many people don't realize they have an infection until it's too late. By the time they see a doctor, the only treatment option may be amputation. And if the infection has already entered the bloodstream, death can occur before antibiotics take effect. This is why deadly infections rank as the #1 diabetes complication, not because they happen often, but because they are the most fatal while giving the least warning. If you have diabetes, never ignore a wound or infection, no matter how small it seems. If a cut isn't healing, looks discolored, or has an unusual smell, seek medical attention immediately. Waiting too long could cost you your limb or your life. Are you ignoring the warning signs? Diabetes symptoms can seem mild at first, but they escalate quickly. Ask yourself, are you constantly tired? Do wounds take too long to heal? Have you been feeling dizzy, confused, or unusually weak? Even if these symptoms seem minor now, they could soon lead to life-threatening complications. Take action before it's too late. Which of these symptoms surprised you the most? Share your experience in the comments. If you found this information valuable, hit the like button and share it with someone who needs to hear this. The more people understand these risks, the more lives we can save.